Hi, everybody. Welcome back. So I'm Dr. Roanna Kessler. I am the Chief Medical Director for Student Health and Wellbeing, and I oversee the Health Center here. And what we're going to talk about today is love in the time of COVID. Actually, we're going to talk about something way more boring, which is health in the time of COVID, but we just put that title in there because we thought it was cool. Okay. So you may hear a nickname for us, which is Hell-Well. Our actual name is Student Health and Wellness, but I've decided to embrace the Hell-Well nickname, and you can think of it as going from a state of fiery hell to a state of wellness once you come to see us, where you're frolicking on the beach with balloons. Okay, so this is where we're located. I put up a QR code. This will take you to our website if you are interested. And we are at 1 East 31st Street. That is the intersection of 31st and Charles. It's where the 7-Eleven is, if anyone knows. So we're kind of across the street from campus. And we are on the second floor of the building. That is our phone number, and I highly suggest that you just put this in your phone right now. You can put it in as SHWC, you can put it in as Hell-Well, you can put it in under any name you want to put it under. Just put it in your phone so that when you need us, you'll already have the phone number. And I'm going to read it out to you guys. 410-516-8270. Because I'm serious, you should put it in your phone. Okay, so you might notice that we also have another tiny clinic across the street from our main clinic, and we're calling this the Annex. And really, this is a clinic that we started during COVID so that we could see people in person who were sick with additional safety measures. We also started up a COVID testing tent over there, so if you ever want to get a symptomatic COVID test, that's where you're gonna go. So that's just right across the street from our main clinic at the same corner, 31st and North Charles. All right, so when are we open? We are open Monday, Tuesday, Thursday, and Friday from 8:30 to basically 5 o'clock. Wednesday, we're only open in the afternoon, and we do also have Saturday hours for when you're feeling really sick. You do need to make an appointment. So again, that's why the phone number is so important, because you do need to make an appointment. We're not a walk-in clinic. You have to call us. However, if we are closed, you can still get advice. So during one of those times that we are closed, you can still call our regular number, and we have a nurse advice line, and they can talk to you about things that you can do to feel better at home, or if you should come see us the next day, or if you should go to an urgent care, or even the emergency room. They can give you advice on all of that stuff when at 3 in the morning you don't know what you should do. You can call that phone number. And then one of our nurses will follow up with you the next business day to make sure that you got what you needed. Okay, I just want to reassure everyone that your medical record is private and confidential, and nothing will be released without your verbal or signed consent. There are a few exceptions to that. One is if you're under 18, but even if you're under 18, there are certain things that we do not need to disclose, especially around your reproductive health care. We do have to report some diseases to the Department of Health. So for example, STIs, tuberculosis, monkeypox, COVID, we have to report all of those. So that information goes to the Department of Health, and they just use it for tracking purposes. And we do also need to disclose, of course, if somebody tells us in the exam room and we are worried that they're a threat to themselves or others. But those are really the only reasons we would ever go outside the bounds of your confidentiality. The best way to ensure that all of your information stays in your medical record is to use secure messaging. And I'm going to show you on the next slide about our patient portal. So this is the link to our patient portal. Hopefully you guys remember you did a pre-entrance health form, and maybe you did it, or maybe your parents did it. And if your parents did it, that means they have the password to your portal, okay? So, big announcement. Log into your portal. If your parents were the ones that did it for you before, change your password. Go in there, change your password so that your medical information stays your medical information, okay? And that's the QR code right up there. if you want to take a picture of it so that you can make sure that you're properly registered for the portal. And that's going to be a great way for you to look at your medical information. Your medical chart visits will be in there, your immunization records, your test results. So there's going to be a lot of information in there. And then that's also the way you can correspond with your student health provider if you wish to do so. Okay, so who are we? We are a lot of different people. We have physicians, we have nurse practitioners, we have nurses, we have a nutritionist who will be joining us shortly. We have medical assistants, we have patient service coordinators who answer the phone at the front desk, and we even have someone who specializes in insurance and referrals to help folks with that process if they don't understand. How much does it cost? Nothing. So you are already paying, just by essence of being here at Hopkins, for your visits to the health center. So please, I encourage you, take advantage. The visits are free. It doesn't matter what kind of insurance you have, the visit with the provider is free. There are a couple things that you will get charged for, but we're not the ones that are charging you. Somebody else is going to charge you because we might do something like send you for an x-ray, give you a referral, give you a prescription, order a lab test. If we do that, that other entity is going to be the one that's going to send you a bill, okay? So if you ever get a bill, it's not from us. It's from whatever other place we had to send you to get what you needed. So we do not want to charge you anything. We have plenty of tests that we can do on site, rapid tests that won't cost you anything. But if we do have to send labs out, then the lab is going to charge you a fee. Nope, not going forward. There we go. Okay, so what can we do? We can do the same things that your primary care provider can do at home. So you should think of us as your primary care provider when you're on campus. So we can take care of any acute illnesses, any chronic disease conditions that you might have. We can do wellness physicals. We can do allergy shots. If you've been getting allergy shots at home, you can transfer that to us and we can give them to you on campus. We can do travel consults when we get to travel again. We're going to do nutrition consults when our dietitian arrives. We do reproductive health care and STI screening. And again, all of this is confidential. And then for your convenience, we do have certain medications on site that you can buy right at the time of your visit. And we also, like I said, have rapid tests and we can do blood draws. So it's really like a one-stop shop to get everything you need. This is a very nice perk that I want you guys to know about. We have a vending machine in our lobby that sells over-the-counter medications. And I want to highlight a specific medication, which is very popular, and that's Plan B. Plan B is emergency contraception. And so we have the generic form of Plan B available for $8. And I don't know if any of you have seen the price at the pharmacy, but usually it's upwards of $40. So this is a really, really great deal. If someone should be in need of that medication, I highly encourage you, come get it from the vending machine. You will need to have your J card. The one on your phone will work too, but you need the J card to get in because after hours, that outer door is locked. But anybody, any student with a J card can gain access. And also, when you buy things from the vending machine, it also takes J cash only. And again, that was what we did just to make sure that it was really benefiting our students and our community. But there are other products in there as well. A lot of our commonly recommended over-the-counter medications. Most of them cost $2, and all of them are under $8 and under. Okay, so now we have to talk about COVID, because it's still here. All right, so this is the QR code for the COVID information site. This has all of the information on all of the Hopkins policies related to COVID. So again, I highly recommend you check it out if you haven't already. And this is the second number I'm going to ask you to add to your phone. And this is the COVID nurse line, okay? So this number is slightly different from our other number, 410-516-5709. That is for our student health COVID nurse. And they are basically available to answer the phone 8:30 a.m. to 6 p.m., 7 days a week. And they can answer all of your questions related to COVID. After hours, again, you have that nurse advice line that you could use. But this is a very important number because things are going to come up, right? And you're going to want advice. You're going to call that number. All right, so just a couple updates on our policies. Right now, there is no mandatory testing for COVID. So it's not mandatory to test for COVID. However, you have a couple of options available should you want to test for COVID. So there are self-test kits, which hopefully everybody got in their res halls. Can I see a nod if folks got them in their res halls? Yeah, some people nodding, awesome. So if you didn't, you can talk to your RA. And they're also available at any testing site and at the Health and Wellness Center. And then the main testing site is actually right here in this building. So if you want to go check it out when you're leaving tonight, you can look at the asymptomatic testing site here, and they should have some self-test kits available there. And so that is also free. It's a saliva-based test, so you don't have to get that painful nose swab. You just have to spit in the tube. And that's what we call our asymptomatic testing. So when you're not sick, but you just want to get a COVID test because like you're going home to visit grandma or something, that's where you can go to get your COVID test done. When you are sick, that's when you're going to come to us to get your COVID test done, and that is the one that goes in your nose and hurts. All right, the way you sign up for testing is through MyChart. Did everybody get a MyChart activation link? Can I see some nods? Oh, good. Excellent. So if you have not clicked on that and registered for MyChart yet, please do so, because this is the patient portal for Johns Hopkins Health System. And so if you ever go to see a doctor in Hopkins Hospital, that will be all of the way that you correspond with that person. Our clinic medical record is separate, so we keep your information private. But this, MyChart, is for everybody in the hospital. And it's also the way that you sign up for COVID tests. So you will go into your MyChart account, and there will be an option, schedule a COVID test. Then it will say, are you sick? Are you not sick? And if you say, I'm not sick, it'll direct you towards one of the saliva testing sites. If you are sick, it will direct you towards our testing site. And there is also an email that you can email if you have any questions about this, and there is an 800 number for MyChart as well. These slides will also be available to you guys after the presentation if you want to look back. Okay, so what should I do if I feel sick? Put a mask on. So we, for a long time, did not routinely use masks when we were sick, but we have now discovered this is a really great tool for preventing transmission of infection. So if you're sick, put that mask on. You're going to be protecting yourself and protecting other people. You're going to schedule a symptomatic test like we just talked about. You can call that COVID nurse number if you have any questions. And if you can't get an appointment, you could take a home antigen test as well, and you can report those results to us. So if it is positive, we have an online reporting form that you can use to submit those results, and then one of our nurses will be in touch with you. And then they try to get in touch with you really quickly, but again, sometimes if it's overnight, they're probably going to call you the next business day. That's okay. But please be sure to answer all calls, even if the phone number looks weird, or sometimes it says restricted, because we're calling from the health center line. It'll show up as restricted, so please answer your phone, because most of you don't have voicemail set up. So if your COVID test is negative, like I mentioned before, you could still wear a mask. That would be really helpful, even for things like cold and flu, to prevent transmission to others. And then if you still need medical care, like you have a really bad sore throat, you think it might be strep, you can come see us for a regular visit. Okay, so this semester, instead of you guys moving to a different location if you have COVID, you're going to stay in your room, okay? So this is what we're calling isolating in place. This and the testing policy are subject to change if we see like really high rates of COVID in the community. We're hoping that doesn't happen, and so we're hoping you can have as normal college experience as possible, and so that's why we want you to stay in your room. So isolation is typically 5 to 10 days. You will get cleared by our nurses. You can leave the room once a day to go pick up food. There will be different pickup locations in the different res halls, but you have to wear a good N95 or KN95 mask when you're out of your room to decrease the chance of other people getting sick. Roommates. So what should you do if you have a roommate who has COVID? You should test yourself for COVID because you've already been exposed to that person, right? And so odds are you may have COVID, so you should take a test. But you're gonna stay in the room with your roommate. And you should keep testing yourself every couple of days just to make sure that your test is not becoming positive. If your test is positive, of course, we will be in touch with you. All right, monkeypox. So not only do we have to deal with COVID, we have monkeypox. So hopefully this does not become a big issue, but in case it does, we have a website started with information for students, so that's the QR code for the website. Just a couple of important points about monkeypox. It's not a sexually transmitted infection. It is transmitted, however, by close skin-to-skin contact. That's the best way to transmit it, but that doesn't mean people are having sex to transmit it that way. The symptoms initially can look just like COVID, right? So it starts out as basically having a cold, like a bad cold. But then a couple days into the cold, you develop a rash. And the rash can look a lot of different ways, but it kind of looks like pimples, is the best way to describe it. But it might be somewhere weird on your body where you wouldn't normally see pimples, like your hand or something. So if you do see that, you can use the same phone number that we use for COVID and call those nurses and let them know. And then we'll take it from there in terms of scheduling you an appointment, having a provider assess you. We can test for monkeypox here, and we will give you instructions, obviously, if we end up doing that. Okay, flu. So flu vaccines are going to be mandatory again this year. They are actually already available at local pharmacies, should you wish to get one. But we will be having multiple on-campus clinics where you can get the flu vaccine as well. And you will need to upload proof of that to the VMS, which hopefully you all know because you all uploaded your COVID vaccine to that system. That's also where you're going to upload your flu vaccine. And this is a picture. Take a picture if you can. This is all the flu clinics that are going to happen on campus. So you can go to whichever one is most convenient for you. But I did put a star. The stars moved all around. They're supposed to be by the one that's on Wednesday, October 12th, because that's going to be our big, giant flu fun party. And we're going to have a big wellness fair, and we hope to give out thousands of shots that day. So if you want to have a good time while getting your flu shot, that's the one I'm recommending. Okay. Last thing is that we welcome your feedback. We always want to improve our services so that we're meeting the needs of our students and providing very high quality care. And so we want you to let us know if you have any concerns. So we have an online feedback form. We also send out a patient satisfaction survey after every visit. And you can also just talk directly to your provider if you have any concerns about the services being offered. And then I put up my email and the email of our nurse practitioner manager in case you want to take a picture of that. You are always welcome to email us directly should you have any questions or concerns, and we will figure out the best way to get you what you need. So I encourage you to email us with any questions, any issues, any concerns at all. And I think I am done.